We are back with the humerus. We were at the proximal humerus up here at the head. Now we would ponder some of these markings down here. And I don't want to point out markings. I want to point out what the markings are for. And hopefully that will help you put them together in your head. One thing I get so excited when I see bone markings because they tell a story of anatomy. They really show you how things are put together, but you have to learn them first. You'll get it. Okay, so what I want to bring your attention to are the trochlea, capitulum, radial fossa, and coronoid fossa, and then on the posterior aspect of the humerus, the olecranon fossa. And one thing we do here helpfully is when we're here on slide 12, we're looking at the anterior aspect of the humerus. And so we've drawn in the proximal radius and ulna here, so you can see how they fit together, and I'll sort of show you how that works. And then posteriorly, we show you again. So if you didn't have complete anatomy or bones in front of you, but you had an imagination, you could start putting together an elbow joint. But we don't need to do that. What I want to show you are the radius and ulna of the forearm. And once I've shown you those two, we can go back and look at the whole elbow joint, including the markings of the humerus. So let's do that. So what this is getting at here is that the radius and ulna make up your forearm. The radius in anatomical position is lateral, the ulna is medial, and there's an interesting relationship between them and what they do that I'll get to at the end of this. They are held together by what's called an interosseous membrane. So numerous ligaments connect these two, and you definitely shouldn't be able to separate them in a living human. So they articulate strongly here and here, and they do a lot of other things. So here are the radius and ulna. If we look at the ulna first, well, this sucks. Let's find an ulna. I would skip this lecture before I would do it without bones that I can spin around. So we were over on the left side. Let's look at an ulna, or this guy, the ulna. Let's look at an ulna first and hide everybody else. So this is an ulna, and it's very distinctive. From the side, it has this hook, or this Pac-Man mouth, or something like that. And what you'll see is that this is the coronoid process, and this is the olecranon. The olecranon is your elbow. This right here is your elbow. So if you bump your elbow into someone's face for some reason, this is what's hitting them. And that'll be important. This is going to be the trochlear notch, which fits the trochlea of the humerus. That's all at the proximal end. If we go down to the distal end, see, I'm having trouble selecting a center of rotation. It does not want to. It wants to rotate around something else, and I don't know what it is. I'm trying to show you the styloid process, and this right here is the styloid process of the humerus. So that's going to be your ulna. And note, this hook here, I said that's distinctive, and it is, and when you look at the radius, you will wonder, where's the hook? Because the radius does not have one. So now we're looking at a radius, and the radius also has a distinctive shape that you would come to know and love. And instead of a hook, it has, I don't know, a pancake. This is a circular, flat, circular flat structure. There we go. And when you see something circular like that, it should suggest to you that it can rotate or roll and roll it does. Also, the radius, while we're here at this proximal end of the radius, it has this bumpy area here, which is where the biceps brachii, that big strong muscle that can flex the forearm, attaches to it. So cool markings. Yeah, the radial tuberosity. And when you're learning to side these bones, which I will help you, you're going to use the radial tuberosity. You'll also use the styloid process. What else? Basically, you can pick which of these markings you use, but what you'll have to be able to do to side them is figure out which side is anterior, which side is proximal, and which side is lateral or medial. And once you can figure those things out, you can side the bone unambiguously. Okay, so let's put the shoulder or the elbow joint together, and then I'll show you kind of how it works. So again, this is a left, which means that this lateral bone is the radius, and this medial bone is the ulna. So I mentioned that your elbow is the olecranon of the ulna. Well, there it is. That's how it fits in there. And the radius doesn't go up there. What this allows is rotation of the elbow. And so you have the trochlea here that fits into the trochlear notch of the ulna, and you have the capitulum here, and the radius is going to rotate about that. You also have, on this humerus, you have a coronoid fossa, which is kind of this indentation where the coronoid process of the ulna can go, and you have the radial fossa where the head of the radius will go when the elbow is fully bent. And then back here is this huge, well, let's see, I can get rid of the ulna here, this huge olecranon fossa, which is where the olecranon process of the ulna goes when the elbow is straight. So that's good, but there's no substitute for seeing it move. And in order to do that, what I want to do is add some muscles and let the software do the work. So yeah, I had to add all of those muscles, believe it or not. And I'm going to use the brachialis muscle, which is very straightforward. It lies deep to the biceps brachii, and all it does is flex the forearm, and it inserts on the ulna. So let's see it in action. Let's watch it flex the elbow. That usually takes some time to load, and let's fade all the other muscles in the motion. So now, when this muscle turns yellow, it's contracting, okay? And what I want you to notice, first of all, is the ulna and how it rotates about the trochlea. So the trochlear notch kind of holds onto it, and it rotates about that. And here the coronoid process goes into the coronoid fossa. The olecranon process goes into the olecranon fossa back here. When this rotation happens, the radius also is going to rotate about the capitulum, and the head of the radius is going to go into the radial fossa here. Okay, so there's logic to all of that, and that's those relevant markings of the humerus. And while we're here, I'll point out a couple more markings of the humerus, and then we'll be done with the humerus. The humerus has epicondyles. So if we focus on the humerus and hide the others and go to a parts view, I don't know, what view do we go to if we wanted to see an epicondyle? Oh, come on. There we go. So this is an epicondyle. And somewhere in here, yeah, epicondyle. There's a medial, and this is the lateral epicondyle. you can feel those on yourself. Like this is one of the places where a bone is very distinctive on yourself. If you grab your elbow, they stick out laterally, medially and laterally. So if I put the rest of the bones on there, just imagine this is your left elbow. You can feel this bump. You can feel this bone. That's medial epicondyle, and you can feel this one. And there's this notch right here for the ulnar nerve. Well, that is your funny bone, so to speak. So the ulnar nerve is going to move down like this and follow the ulna, and it's going to innervate a few of the muscles of the forearm and the hand, but it has to get there from the spinal cord, and so it has to pass through this, and that leaves it exposed. And so if you accidentally crush something into this space here, you compress the ulnar nerve, and the ulnar nerve tells you to stop by giving you a distinct sensation. So that's your funny bone right there. Okay, so I've showed you the radius and ulna. There's one other major motion of the radius and ulna I need to talk about, and that is pronation and supination. So in anatomical position, the palms are facing anteriorly. So the palm of the hand, or the palmar region of the hand, is facing anteriorly, and the metacarpal region is facing posteriorly. But you can easily flip your hands over. You'd no longer be in anatomical position, but you can easily stand with the back of your hand facing anteriorly. And that's, when you do that, you have pronated. So what I want to do is make this a little bit easier to see by changing the model. So now we're just looking at just looking at the upper limb on the left side. And I shall add some muscles. And this is going to be useful because I believe, yeah, we have a pronator muscle. So pronator quadratus, this is your strong pronator. So if we show forearm pronation, we have, two muscles doing it, pronator teres and the pronator quadratus down here. Look carefully at what's going on with the radius. The radius is rotating relative to the ulna. The ulna is not moving at all. So the ulna will stay fixed, and the radius does all the moving when you do pronation. So this, here we go, pronation, supination, pronation, pronated, supination, fully supinated. Pronation and supination just undo each other. That explains, hopefully, why the radius is shaped like it is up here. And you're going to have several muscles that are devoted to allowing that exact motion, pronation, and then several that undo it that allow supination. And in all those cases, those muscles have to connect to the humerus or the ulna and the radius. And they basically pull the radius to one side or the other. So, cool. There's that. And let's get rid of those muscles and keep going, because we have reached, oh yeah, cool. You can look at that stuff, Yes. This is all stuff I've talked about. Here's a good one. The ulna has this radial notch right here that the radius can kind of rotate in. That's really useful marking. If we, let's see, if we get rid of all the other bones and just look at the ulna for a second, this is the radial notch. That's exactly where the head of the radius was just then. That's useful because when you're trying to side this bone, it's easy, once you learn it, it's easy to know that this is the anterior side. Once you've studied this a bit, it'll be easy to see this is anterior. It'll be easy for you to see that this is proximal and this is distal once you've studied it. It is not easy to see which one is lateral and which one is medial. So from a distance, there's nothing to tell you what's lateral and what's medial. But the radial notch faces the radius, and the radius, not trochlear, this is the radial notch. Let's see if I can find a better... I'm not going to spend much more time on this because life, you know? You know what I mean? Life. Radial notch. Okay. Yeah, that's the radial notch, and it faces the radius, and the radius is lateral. So, once you've found the radial notch, that's on the lateral side. And that would be what it takes to fully side an ulna. So there you have that. Let's keep going. Okay, once you get to the distal part of the forearm, now you're looking at the surfaces that articulate with the wrist joint, or the carpal bones. In particular, the radius articulates with the carpal bones. The ulna doesn't really. The ulna is going to articulate with the radius, and the radius is going to articulate with the, carpal bones. You know what time it is. It's time for an ugly drawing by your anatomy professor. So, ugly drawing time. A person has a head. People who take anatomy are thrilled with life all the time. You have a pectoral girdle, and I'm not interested in drawing these things in detail. What I'm trying to draw here is the organization of the upper limb and the weight-bearing structure. What you have, let's just say you have a structure that holds the humerus. And this is your humerus, so to speak. So, humerus. The humerus is attached to the ulna. The radius hangs off of the ulna. So did you get that? The radius is not hanging from the humerus, it's hanging from the ulna. And the ulna is hanging off the humerus. So it goes humerus, ulna, radius, and then the carpal bones in the hand attached to the radius. So it is kind of a weird situation where the carpal bones in the wrist and the hand, that is all hanging from the radius. The radius hangs off of the ulna, and the ulna hangs off of the humerus. What that allows is pronation and supination, basically. So we get strength in the elbow joint from the ulna, and then we get flexibility by having this radius the hand hangs from. If the hand were attached to the ulna, it wouldn't be able to move. It wouldn't be able to pronate and supinate. So there you have that. That's all straightforward. This is what I was just saying and trying to draw. Here we have the hand anatomical region. So this is something that comes up on the bone exam. One of the essay questions is name every bone of the hand. There are a lot of them. I will show you how to name all these bones. It is tempting to look at this once you know how to name the bones and not really study them. And you will be embarrassed when you take the muscle or the bone exam if you forget these bones. So take them seriously. So we start with the carpals. This is the wrist. These are the bones that allow a lot of flexibility. And there are 8 of them in 2 rows. So this is one of the rows, this is the proximal row, and then this is the distal row. And these are the bones. In the proximal row, scaphoid, lunate, triquetrum, and pisiform. Triquetrum is also known as the triangular bone. And the pisiform kind of hangs off the triquetrum bone. So the scaphoid and lunate are the strong bones that are going to attach to the radius. And then the hamate, capitate, trapezoid, and trapezium are going to articulate with metacarpals. These are the metacarpals. So these would be the bones of your hand, of what we normally think of as our hand, or the palm of your hand. And then these would be your fingers, or phalanges. And this says the pisiform appears to be part of the triquetrum in our models. Don't worry about that. You're not even going to see our models. So 2 separate bones. The carpals take time to learn, and it helps that there's a very good mnemonic device for this. This is the best mnemonic device I've seen in anatomy. And it goes like this. Straight line to pinky. Here comes the thumb. Scaphoid, lunate, triquetrum, pisiform. Straight line to pinky. Here comes the thumb. So what that gives you is your directions, and it gives the bones in order like this. And baked into that mnemonic device is the direction you're going, because the end of the first line is the pinky. That's going to be this, what's the word, medial side. And then you're going to move laterally to get back to the thumb. What you have to do here, even though you have this great mnemonic device, what you're going to have to do is practice. You'll have to learn to identify these bones, usually from this kind of anterior view. And I want to draw your attention to this. Mnemonic devices like this help you encode information, but they don't help you retrieve it. You still have to build retrieval pathways, but they help you a lot with the encoding. That's what it is. So you have to practice using a mnemonic device for it to help you on the exam. The other thing is, this mnemonic device doesn't tell you, is this the proximal row or the distal row? Is this proximal or distal? So you have to know that it starts with the proximal row. Straight line to pinky is proximal. And then also, trapezium and trapezoid both start with T, which is which? Well, the way I remember it is that trapezium articulates with your thumb. Trapezium articulates with your thumb. That's how I remember it. Where we're going to finish this video is with the metacarpals and phalanges. I'll just show you how to name all these bones. So the metacarpals are the bones of the palm of the hand, or the metacarpal region, the back of the hand. You have 5 of them, and they're named with numbers. So 1, 2, 3, 4, 5. That's Roman numerals for 1, 2, 3, 4, and 5. And the thumb is going to be 1. So if I point at this bone and say, what is it? The right answer would be metacarpal number 4 of the right hand. And you'll get there in terms of knowing right and left. The metacarpal bones are what we call long bones. They have an epiphysis on both ends and a diaphysis connecting them, or a head, a base, and a shaft. All of these bones, the metacarpals and all the phalanges, are long bones with 2 diaphyses or two epiphyses and a diaphysis. They all have a base, a head, and a shaft. The thumb is also known as pollex. The phalanges are also numbered, but you'll find that we have proximal, middle, and distal phalanges. So phalanx is singular, phalanges is plural. So this bone, if you had to name it, would be proximal phalanx number 4 of the right hand. this would be middle phalanx 4 of the right hand, and this would be distal phalanx 4 of the right hand. One thing you'll notice is that the thumb is different. The thumb is missing a bone. It does not have a middle phalanx. This is proximal phalanx 1 of the right hand, and this is distal phalanx 1 of the right hand. Those are your phalanges. And again, practice this, get somebody to quiz you, because this is deceptively simple, but until you work through it and force yourself to name some of these, you're not going to be able to do it. So force yourself to go through and name some of these with somebody quizzing you, and that's what you can use your teammates for, or whatever. That's the end of the upper limb. Now you've seen all the bones of the upper limb, and I'll make a separate video for how to side bones in general, and we will get to that when we get to that. So hang in there, people. Learn the bones. Good luck.